Welcome back to the Deep Dive. Today we're tackling a topic that, well, it can sound a bit scary for parents. Heart murmurs in children.
Definitely. That word murmur linked to the heart can cause some anxiety.
Exactly. So our mission today is to really understand innocent heart murmurs. What are they? Why do kids get them? And crucially, why they're usually nothing to worry about.
Right. But also touching on when, maybe a bit more investigation is needed.
Okay, so let's dive in. Definition first. What exactly is an innocent heart murmur?
Okay. Simply put, it's a sound. A sound the doctor hears with a stethoscope, but it's not caused by any structural problem or actual disease within the heart itself.
So a sound without a problem.
Pretty much. They're benign, harmless, and actually really common in perfectly healthy kids who have no symptoms at all.
Right.
But, and this is important, sometimes a murmur can signal a structural issue, and sometimes, especially in newborns with congenital heart disease, that murmur might be missed initially.
Okay, good distinction. So if they're not from a problem, what does cause these sounds? The etiology.
It really boils down to normal blood flow dynamics. Think about blood moving through a healthy, structurally normal heart and the big blood vessels. Sometimes just the normal way the blood flows, especially in children whose systems are, still developing, can create a little bit of turbulence or vibration.
Ah, like water flowing through pipes. Sometimes you hear it.
Exactly like that. It's just the sound of normal function.
Got it. Are there specific risk factors then? There are certain ages.
Well, you can find innocent murmurs at pretty much any age during childhood, even into adolescence.
Okay.
But interestingly, there aren't specific associated risk factors for the innocent murmur itself. It's just, common in healthy kids.
So it's not like doing something specific makes you more likely to have one.
Not for the innocent type, no.
Right. Let's talk pathophysiology then. What's actually happening to make the sound?
Yeah.
You mentioned turbulence.
Yeah, exactly. Turbulence or vibrations. It's the normal blood flowing through a structurally normal heart and vessels. Maybe the heart's pumping strongly, maybe the blood's flowing a bit faster because the child's active, and that creates these vibrations that we can hear. It's not a sign of a leaky valve or a hole like in pathological murmurs.
Okay, that makes sense. So the big question for doctors must be telling the difference. How do you differentiate an innocent one from, a not-so-innocent one?
That's the crucial part, absolutely. Distinguishing them is key. And there are certain medical conditions where you'd be more suspicious if you heard a murmur.
Like warning signs.
Sort of. Conditions associated with a higher risk of actual heart defects. Our sources mention several. It might be helpful for you to remember them with something like Downs, Noonan, Turner, Marfan, fetal alcohol, rubella.
Okay, let's break that down. Down syndrome.
Yes, Down syndrome, Noonan syndrome, Turner syndrome, Marfan syndrome, fetal alcohol syndrome, and congenital rubella infection. If a child has one of these, a murmur warrants a closer look because heart defects are more common.
That's a really useful mnemonic, thanks. So just how common are these innocent murmurs overall, epidemiology-wise?
The precise numbers aren't crystal clear, but they are detected very frequently. During routine checkups, sports physicals, lots of healthy kids will have one noted at some point.
Right, very common then. Clinically, how do they present? You said asymptomatic.
For innocent murmurs, yes. The key is they're found incidentally in a child who feels perfectly fine, no symptoms at all.
But what about the murmurs that aren't innocent? What symptoms should make parents or doctors concerned? Let's start with infants.
Okay, for infants, red flags would be things like breathlessness, especially during feeding, poor feeding generally, maybe excessive sweating, any blue episodes, what we call cyanosis, seeming generally unwell, not gaining weight properly, that's faltering growth. Also, a positive family history of heart problems is important.
And what might a doctor find on examination in these worrying cases in infants?
They'd look for fast breathing, which is tachypnea, or a fast heart rate, tachycardia, an enlarged liver, hepatomegaly, poor peripheral pulses, low oxygen saturation levels, maybe raised neck veins, crackles in the lungs, signs the heart isn't coping.
Okay, quite a list. And for older children, what are the warning signs then?
In older children, it's more about things like exercise intolerance, getting tired much more easily than their peers, palpitations, chest pain, maybe fainting episodes, which is syncope.
Right.
And some signs can overlap with infants, like fast breathing or heart rate, maybe swollen legs or feet pedal edema or an enlarged liver and poor pulses again.
Those are clear things to watch for. So if a murmur is heard, how are things investigated?
Well, the initial diagnosis is really based on a good history and a thorough physical examination. Listening carefully to the characteristics of the murmur, its timing, loudness, location, gives a lot of clues.
And if there's still doubt?
Then an echocardiogram is the next step. It's an ultrasound of the heart. It gives a clear picture and can definitively rule out any structural abnormalities.
Okay. So let's say the echo confirms that it's just an innocent murmur. What's the management?
That's the best part. No specific treatment is needed. Zero.
Really? Just reassurance.
Reassurance is key. Sometimes a doctor might advise just, keeping an ear out at future checkups just to monitor that it remains innocent, but often it's just case closed. Many fade over time anyway.
And the prognosis, long-term outlook.
Excellent. Absolutely excellent. Once it's properly evaluated and confirmed as innocent, there are no long-term health issues, no restrictions on activity, nothing.
No complications down the line.
None at all from the innocent murmur itself. The only complication would be if a significant murmur indicating a real condition was mistakenly thought to be innocent. That's why a careful evaluation is important.
Right. Ruling out the other stuff is the main job.
Exactly.
So, to summarize, the big picture here is innocent heart murmurs, very common, usually just the sound of a normal, healthy heart doing its job. But hearing murmur means a doctor needs to listen carefully and maybe do an echo just to be absolutely sure it is innocent and not masking something else.
You've got it. It's about careful assessment and providing reassurance when it's due.
It really makes you think, doesn't it? Considering how common these are, what other things do we see in kids that sound alarming but are often totally benign? Something to ponder.
Definitely food for thought.
Well, that's all we have time for on this deep dive. For more revision resources, remember to check out pastthemsesri.com and freemesri.com. Thanks for joining us.